You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're glad you joined us. Before we begin, I'd like to thank our sponsors, Aultman Health System, Studio Arts and Glass, and Genuine Appraisals and Liquidations. I'm joined by Brad White, compounding pharmacist and vice president of operations. Today, Brad and I are broadcasting from our administrative offices, and our special guests are Dr. Olyejar with Aultman Radiation Oncology and Tina Biasella, Vice President, Cancer Services. Good morning and welcome to our show.
Good morning.
Morning.
More than 14 million new cases of cancer are diagnosed globally each year. Radiation therapy has the potential to improve the rates of cure for 3.5 million people and provide more palliative relief for an additional 3.5 million people. These conservative estimates are based on the fact that approximately 50% of all cancer patients can benefit from radiation therapy in the management of their disease. A radiation oncologist is a doctor who specializes in providing radiation treatments to cancer patients, and they work closely with team members to create a treatment plan. This morning, we're going to talk with Dr. Olyejar and Tina Biasella about radiation treatments for cancer, as well as exciting news they have to share about the opening of Aultman's new cancer center. Today's program is also going to be available on our podcast. Just look for Health Matters with the Medicine Center Pharmacy in your favorite podcast app, and please subscribe.
So, Dr. Olyejar, again, welcome to the show. We're happy to have you here today. Please tell the listeners a little bit about yourself and your background.
Sure. So I'm the new medical director at the Aultman Radiation Oncology Center at the Timken Family Cancer Center at Aultman Hospital. I'm originally from eastern Colorado, grew up in rural Colorado, did my medical school in Colorado, my residency out in Charleston, South Carolina, and practiced for almost 20 years in the Phoenix, Arizona area. And then recently took this job as a new adventure. So my wife and I have settled out in North Canton. We're really enjoying the area so far. I've got two daughters, one's in college, and the other one's just about to be in college. So
I've been to Colorado numerous times. It is beautiful out there. I can imagine that was a hard one to make the decision to change. So why radiation oncology? What made you decide on that?
It's a job that I really love and I'm really passionate about. It's a really nice blend of, very close patient care, long-term relationships with those patients, but also I get to play with really cool technology. We have absolutely amazing state-of-the-art. I'm a bit on the nerdy side, like most radiation oncologists are. We love, computers and new tech and, fancy equipment and toys. And this, I get to really use those to make my patients' life better. So it's, I couldn't think of a better field to practice in, actually.
So what kind of training does it take to get to a specialization in radiation therapy?
Yeah, so like most physicians, it's 4 years of college and 4 years of medical school, and then radiation oncology is a 5-year residency after medical school. So wow. 13 years worth of training.
So what types of cancer do you treat with radiation?
So the answer is most what we call epithelial cancers, which are cancers that start, anywhere from the skin to most of the solid organs. The few cancers that we don't treat, I would call like we call them liquid cancers, like leukemias and things like that. There's a couple cases of leukemias that we actually give some treatments for, but so mostly it's solid tumors. You can think of lung cancer, breast cancer, prostate cancer, brain tumors, esophageal cancer, pancreatic cancer, colorectal cancers, sarcomas, skin cancer, melanomas. Pretty much, if you name a cancer besides the leukemia, radiation's involved in some of the cases.
Dr. Olyejar, do you have?
Go ahead. I'm sorry. Go ahead.
Dr. Olyejar, do you have a specific cancer type that you have interest in or want to treat more of?
So, as a radiation oncologist, we tend to be pretty broad in terms of what we see. I have special interest in brachytherapy. So brachy, B-R-A-C-H-Y, is the Latin root that means against. So basically what we're doing is either implanting radiation or directly putting it into the tumor right against the tumor. And we actually use a radioactive source for that. So a lot of those are in the operating room, hands-on, and that's one of the things that I definitely am passionate about.
When someone needs to have radiation, what types of treatment are available?
So it's vast, and it depends on, again, what the goals of the therapy are. So, but the main ways we treat patients is with an X-ray machine. So we call it external beam radiation. So the patient lays on a table, and the machine will shoot X-rays targeted where we plan it out to treat. And that ranges anywhere from, very simple, where we just shoot an X-ray beam from the front and the back at a tumor in a bone, for example, to very complicated technique called IMRT, or intensity modulated radiation, where we're actually painting the radiation dose three-dimensionally to scope and shape that dose around critical organs. And then even more advanced is something called stereotactic radiation or stereotactic radiosurgery, where we do pinpoint doses, very high doses to spots to ablate tumors. So we use that in lots of areas like brain tumors and lung tumors, liver tumors. And then the brachytherapy that I mentioned, where we actually implant the radiation into the patient.
So can you touch on, you've mentioned a lot of things, and I just wonder if, what are the differences in those types of treatments for the benefit of our listeners?
The main benefit of brachytherapy, for example, is the radioactive material that we use has very low energy X-rays or gamma rays that are emitted. So they're very soft, meaning they don't penetrate very deeply. So if we put the radiation inside the tumor, the dose of the radiation doesn't spread. So that's the goal of most of the therapy that we're doing, is to try and get the dose confined to the tumor and really limit how much dose goes to the normal tissues that surround it. And that decreases the side effects during, and then the potential for late side effects too. And then the more dose that we can put in, the higher the chance of controlling the cancer is. So most all of these technologies are designed to improve our ability to focus that radiation. If you kind of think of, a flashlight versus a laser, we're able to really focus the radiation, and, again, pinpoint is always the goal.
How often and how long do patients need to receive radiation?
Yeah, so again, it's very variable depending on what we're doing and what techniques are involved, for sure. So the stereotactic radiation that I talked about, that can be delivered a whole course in as little as one treatment. It's usually somewhere between 1 and 5 treatments that are delivered every other day. And those treatments take about 15 or 20 minutes, something like that. A standard course for common cancers like breast cancer typically ranges in the range of 4 to 7 weeks, and those treatments are given every day, Monday through Friday. So they come in 5 days a week for that.
Wow.
4 to 6 weeks. Those treatments are quite quick, though, 5-ish minutes, so somewhere around 10 to 15 minutes door to door for them every day. Prostate cancer, obviously, is a very common cancer we treat as well. Those range anywhere from 5.5 weeks to up to 9 weeks of treatment, depending on what areas we have to treat and how aggressive the cancers are. So that kind of limits that. A patient who has metastatic cancer, so cancer that spread from the site to somewhere else, like commonly we'll treat cancer that spread to the bone. Patients will get, can get really painful lesions in bones, and we treat those with radiation. And that can be done, typically 5 to 10 treatments. Those are, again, given 5 days a week for in and out in 10-minute kind of situation.
Wow. So what about your new technologies that you have to treat patients at Aultman? I'm guessing you might have had some upgrades to equipment with the construction of the new cancer center?
We did. We really did. The hospital, the cancer center, Tina, they really outdid themselves in terms of, what they purchased. They really bought the best, most latest and greatest equipment that really money can buy. So the machines that we have, they're called Varian True Beams, which allow us to treat really everything. There's almost nothing that we can't do with our machines. They're They're very specialized, and they have something called onboard imaging, so we can actually take CAT scans of the patient right before treatment to make sure we're hitting the exact right spot and the setup is perfect right before the treatment. All those things really play into, how much margin around the radiation we have to put to account for those sorts of things. So we can really tighten up the doses that we deliver to patients and really give a much higher quality treatment. And I dare say that, equipment and our capabilities really rival anything in the country available.
Both of my parents in the 70s and early 80s had radiation therapy for cancer, lung cancer, mouth cancer, all that sort of thing. So that was 40 years ago. So the improvement in radiation therapy must be dramatic. Is that so?
It absolutely is. If you think of what a home computer looked like back in the 1980s, they were huge and could do almost nothing. And compare that capability to, what an iPhone can do now. It's blurry.
Yeah.
But what an iPhone can do now is, night and day, miraculously different. And that technology's followed along with radiation too. So our ability to treat patients has gotten unbelievably better. And even, in the early 80s, some places didn't even have CAT scans available. So the treatment planning was truly two-dimensional, if you can imagine, right? Now we've got full three-dimensional, and it's actually even, we call it 4D, where we can target tumors as the lung moves with the therapy. So, night and day difference in terms of how we do things and really what effect it has on the patients in terms of side effects. Folks in the 80s that got treated typically had a lot of pretty profound side effects compared to what we do now.
Right. Okay, time for our first break, I think, isn't it, Brad? You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. We would like to welcome all customers from Dartmouth Pharmacy, which we purchased this week. We look forward to serving you and helping you with all your prescription needs. So, Doctor, tell us about the new brachytherapy equipment that you have in the new center.
Absolutely. So, the nice thing about us getting that machine is we are the only one in the county that has it, Stark County. So patients don't have to travel, over an hour to get these treatments. The brachytherapy, the things we can use brachytherapy for, really shorten courses of treatment. We can give a full course of treatment for an endometrial cancer with brachytherapy in just 5 days.
Oh,
instead of 5 weeks.
Wow, interesting. While we're talking about the radiation, and you did say that the equipment that the Aultman Cancer Center has is very, very new and very sophisticated. Is that the case, and is it up to snuff with everybody, or?
It's it is by far the best in the area. Yeah.
Maybe what I should have said was not every hospital in the country can do radiation therapy. That's correct, right? I mean, that's a specialized situation.
The majority of hospitals in the country actually don't have radiation, so it's only the larger hospitals that are going to have radiation for sure. So, the equipment that we have, would rival any major metropolitan university center, without question.
Okay, so I know you're excited about the opening of the new cancer center in. How will it benefit the patients that you see and treat? I mean, is it certainly more sophisticated than prior, at Aultman? So. Yeah,
it's absolutely fantastic. The space itself is absolutely gorgeous, and I think it, just being in a space like that provides some healing for the patient. I think without question, they feel and know that they're special to us. But in terms of the direct patient care, the infusion for the chemotherapy and the radiation, they're all basically in the exact same place. It's really, we're just a doorway apart. So if we have complicated patients, it's really easy for me to just walk down the hall and talk to one of the medical oncologists about, managing care of the gynecologic oncologist patients. But they can get their chemotherapy, come right down the hall and get their radiation. A lot of them will get those treatments on the same day. So it really saves them a lot of time. And they have, tons of other services that I know Tina's going to talk about, but they can get their labs done there. They don't have to go to the outpatient lab center and then go all the way over across campus to get their chemo. And it just makes it a one stop for them. Plus they've got their own dedicated parking, and it's really just going to make life easy for them. It's easy to find. We were joking in clinic yesterday that, all the patients were coming on time, because prior they would have to go through one of the 7 entrances to the giant Aultman hospital. They'd get lost. They'd end up in radiology a lot of times. And now they can park right out front. They see the sign, they walk right in, and they're on time. So it's, obviously easier for them, and it makes it great for us too. So.
And that's really wonderful. So what other cancer physicians do you work closely with in treating patients?
Sure, absolutely. So, we work very closely hand in hand with gynecologic oncology. So they treat the female cancers. I work very closely, talk to them almost daily, the medical oncologists, the doctors that provide, chemotherapy and treat hematology diseases as well. Head and neck surgeons, they're the ones that do the operations for the mouth and throat cancers. Urologists, when we treat our prostate and bladder cancer patients. Breast surgeons we talk to almost daily as well for the breast cancer patients. And then there's thoracic surgeons that we see, and then general surgeons with a number of other cancers, and then colorectal surgeons. So it's a lot of people on my speed dial.
Okay. What recommendations do you have for patients to prevent cancer?
Yeah, the number one by far and away is to not smoke or stop smoking if you do smoke. A lot of the cancers that we treat are, direct result of smoking. Mouth cancers, throat cancers, esophageal cancers, lung cancers, bladder cancers, kidney cancers. Those are big ones. And we have excellent evidence that screening saves lives. Mammograms, Pap smears, and now we're doing low dose CT scans for patients with a long smoking history. And then, genetic testing has really made a big difference for a lot of patients. If you have a strong family history for cancers, seeing a genetic counselor to see if you're a candidate for blood tests, to see if you have any genetic disorders that predispose you for cancer, that puts you in a whole different realm in terms of screening frequency and what kind of tests we do for those patients.
Amazing.
All right, Tina, please tell us a little bit about yourself and what you do at Aultman.
Yeah, we're not ignoring you. Okay.
I've been patiently waiting. Yeah, I'm tagging on to this radiation oncology segment here to be able to talk about the Timken Family Cancer Center. Obviously, radiation oncology is such a huge component of what we do, so it all ties in together very well. But I'm Tina Biasella. I'm the Vice President for Cancer Services here at Aultman. I've been at Aultman for 23 years, and so I started very young. I'd like to say,
15, 14 or 15 or something like that, or what?
She was 12.
Okay.
Sorry.
All right.
I went to school here at Aultman when it was just a college of nursing, actually, or excuse me, a school of nursing before it became a college of nursing. And so I started as a staff nurse in the medical intensive care unit. And then went back to school for my bachelor's degree at Malone, my master's degree at the University of Akron, and then became involved in different administrative positions. But I've had the pleasure to be the vice president for the cancer program for the last 10 years. And so been able to see a lot of really great things happen in that time. And best part of it, is opening the doors here on the Timken Family Cancer Center. But in my role, I oversee all the oncology operations across the system of our hospitals.
Interesting.
So how many cancer patients does Aultman serve annually?
Yeah, so we see about 1,700 newly diagnosed cancer cases a year here at Aultman across our system of hospitals. The majority of those, about 1,500, are diagnosed or treated here at the main campus. And then we do see some diagnoses, at our Aultman Alliance, Aultman Orville facilities. But annually, we've done estimates. We treat or evaluate or follow up with about 4,000 cancer patients a year. So the 1,700 is the newly diagnosed cases. But cancer patients, they require a lot of treatment. They require a lot of follow-up once they get into that survivorship phase. And so they're coming through our doors a lot afterwards for continued monitoring and treatments and therapies. So when we try to put our hands around that number, it's about 4,000 patients a year that are coming through for some sort of service here.
Jeez.
So let's talk about the Timken Family Cancer Center. It's open and serving patients, correct?
It is, yes. We had our ribbon cutting on September 7th, and then we opened our doors on Monday, the 12th, to see patients. And so it's been great to welcome patients into this space and see the building, I guess, sort of come alive, so to speak. You know, I've been walking through it for the past year and a half under construction, and so to see patients in it and hear voices and talking and see the staff working in the spaces has been really amazing.
I guess it's time for the break. It is the bottom of the hour. You are listening to Health Matters with the Medicine Center Pharmacy.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your host, Paul White. This morning, Brad and I are talking with Dr. Olyejar and Tina Biasella from the Timken Family Aultman Cancer Center. We have a lot more to cover this morning, so let's get back to the show.
All right. Well, since our medicine center in Canton is right in front of the cancer center, it's been exciting to watch it get built, and it seems like it really went up fast, but I'm sure that it took a lot of planning. Can you talk about the planning and design and the construction of the new Timken Center?
Yeah, you're right. Construction did go quickly, but there was a lot of planning done before that timeline. So, we've been working on this project for really the last 10 years, dreaming about it, planning it, designing it. Obviously, there was a large fundraising component. All of those things, take a lot of time. And when you take on an endeavor like this, you want a building to last a lifetime. So we really wanted to put forth, the effort necessary to make sure we can serve the community for years to come. But really, in earnest, the last 3 to 4 years is when we've been really deeply involved in the planning, the looking at locations and determining, where it was going to go from that perspective. But from a construction timeline, it did move quickly. This project actually was supposed to start in the spring of 2020, but we all know what happened in the spring of 2020. COVID came upon us. And hospitals largely, around the country shut down when that happened. And so we took a minute to pause, on that construction just to kind of see where things were going to happen with healthcare, what was going to go on with the world. And what we found during that time was that cancer care did not stop. It was the one service in the organization that kept seeing the same volumes of patients every day. We couldn't afford to shut down our services to patients. We needed to provide them with chemotherapy, with radiation. People were still getting new cancer diagnoses. And so once we realized that the pandemic really was not going to have an impact on cancer, we made the decision to move forward with the construction piece.
How did you decide to place it on the main campus?
Yeah, good question, Paul. Aultman covers a lot of real estate in the Stark County area here. And when we looked at options, we really vetted a lot of different options for this. We looked at some of our freestanding buildings that we have, if we could occupy spaces there off the main campus. We looked at vacant land, to determine if we should just do a complete new construction. We looked at spaces inside the hospital and tried to see could services be consolidated or changed so we could just do a huge renovation project. But ultimately, through all those analyses, we determined that putting the building here on the main campus was going to benefit the patients, the physicians, the best. It's close to all of the other services necessary for cancer patients, like diagnostics and radiology services. It's also close, it connected to the hospital from an inpatient care perspective. So this building is all outpatient services, but many cancer patients require ER visits and inpatient stays. And so having that all tied together really was going to serve everybody in the best way.
So how big is the new building, and what about the renovation to radiation oncology that was part of this project? Certainly some of that was in the other main building, and you're vacating that area now. What are you going to put there?
Yeah. So this building is a 45,000 square foot addition to the campus, and so that is the new construction component. Radiation oncology is 13,000 square feet, and we actually renovated radiation oncology in place, and so they did not move from their prior location. But what we did was, we took everything down to the studs and completely overhauled the layout, the flow, the decor. It's kind of like when you renovate a house and you take it down in different segments. We started the renovation of that department actually in December of 2020. And so once we figured out the pandemic wasn't going to change our plans, we wanted to get started. And so we started the renovation. And we never stopped treating patients during that time. So it was a very complex and intricate renovation, but they were completely upgraded, as Dr. Olyejar mentioned, with new equipment and capabilities. $5 million actually in machine technology down there is what was added to that department. So we replaced every piece of our old equipment with brand new state-of-the-art capabilities.
I saw the figure $26 million to build this. Is that accurate?
28 million.
28, okay.
Yeah, that's the project in total, and that includes all aspects of the radiation oncology renovation, as well as the new building itself.
I see. And you can walk. I guess I've looked at it, but it's a walkover. It's not connected to the Aultman building or a hospital building. Is that right?
It is connected at 3 different points to the building itself, and so there's a connection when you walk into the building. That's actually the ground level that connects to the ground level of the main building there. So there's a connector walkway there, which is where you would access radiation oncology there on the ground level. We also have a connector to the first floor of the hospital, so that it will get you onto that first level, sort of by the gift shop and the elevator to access all of the inpatient components in the main building. And then we have another connector in the back to radiation oncology. That's sort of the back of the house connector. When we designed this building, we wanted to keep everything very calm for the patients. The environment's very soothing, and so there was a lot of work put into the whole front of the house, back of the house concept. We don't want supplies being delivered to the main lobby or, emergency teams coming in that way. So we were really careful to create a sort of backdoor access to this building as well.
So it's an amazingly efficient layout.
It is, yeah. It really, this week, I think we've gotten, obviously, is the real test of its efficiency, but all of our spaces prior to this were very cramped. They were very congested. The flow wasn't great. We spanned many different areas of the hospital, from the ground level of the main building all the way out to the physician office building on Tusk. So services were everywhere. And to see the spaces working, in the way that we dreamed that they would, has just been really, really awesome to see.
Wow. Amazing.
You mentioned some fundraising earlier. Can you talk about the community involvement and the donations that helped build the Cancer Center?
Yeah, thanks, Brad, for that question, because I'll tell you, we could not have done this without the support of the community. The community has been deeply invested in this project. So $28 million, $10 million of which was Aultman's capital contribution to the project. And so the remaining $18 million was fundraised here from the community. Cancer is something that touches a lot of people, whether personally or through their families or friends, loved ones. And so there definitely was a real desire in the community to build this, to be able to serve the patients in our community. So, the Women's Board of Aultman Hospital, they really kind of kicked off the fundraising for this. We have our annual angel auction and other fundraising events through the year, but back in 2012, they committed their largest pledge ever of $5 million towards this center. And so that really kind of kicked off the community involvement. And then, we're very, very fortunate to receive such a wonderful gift from the Timken Family Foundation, which the building, is named after, $3 million from their foundation for the Timken Family Cancer Center. And then several different foundations in the community, the Hoover Foundation, Dubel Foundation, Stark Community Foundation, as well as a lot of grateful patients, and seeing the community come together, whether it was, a large $3 million gift, or whether it was, just $50 or $100 from someone who had services here. It's really been great to see that.
So how about we touch on some services that are available to patients at the Cancer Center?
Sure, yeah. So I think the best thing about this building is it is truly a comprehensive cancer center, which is something that you would find, at a larger academic or a larger metropolitan hospital. It's not common to see something of this size and this scope in a community hospital setting. And so patients, as Dr. Olyejar mentioned, is really just a one-stop shop for them. They are coming in the doors with that very quick parking, not a lot of walking. They're accessing infusion services, radiation oncology services. We have a full-service lab, so patients receive lab draws and lab analyses on the day of their chemotherapy treatment. So they come in through the doors, get their labs drawn, they see their physician, and they head right over to infusion. So it really cuts down on the distance that they've had to travel, to receive all of those services. We also have a full mixing pharmacy. So obviously that's right in your wheelhouse. If you'd like to come take a tour of that, we'd be happy to show you. But we mix all the chemotherapy drugs that we deliver here right in the building, again, which is a time-saving step for the patients. There's not a lot of travel to get those drugs, to their treatment care, which has been really great. And we also have, a lot of supportive services for the patients in this building. So we have a resource center in the building, which is a sort of a library, so to speak, of different educational information. It's staffed by one of our colleagues and are able to, help patients look up their diagnoses, get answers to their questions. All of our patient navigators, who are a team of registered nurses that work with patients from diagnosis all the way through their treatment, they're here in the building. Our cancer dietitian, our oncology social worker, they're all here in one location and able to be accessible by the patients and also the providers.
Interesting.
It certainly takes a village to navigate the treatment options for patients. I can only imagine how getting all those teams to work together must really be a benefit for the patients.
Absolutely. Absolutely.
So, excuse me. What about physicians? Do you have physician offices located in the center as well?
Yep, that's another really great component. All of our physicians are in one location now. And so as Dr. Olyejar mentioned, many physicians are involved in the treatment of a cancer patient. And before they were scattered all, over the different parts of the hospital, and it required lots of phone calls and pages and messages to be able to connect them. But now they're all here in one location. And so we've got our medical oncology team, our medical oncologists here in the building, also our palliative care physician team here in the building. Gynecologic oncology is here in the building as well. And we've also got, the ability to host what's called a multidisciplinary clinic in the building. And so that's a space that can be utilized by a number of different providers on various days of the week. So if you think about cancer patients and you think about, like, say, a urologist, for example, they don't see only cancer patients. So for them to be in the building doesn't really make sense because they see a lot of non-cancer patients as well. But they do see a lot of cancer patients, prostate cancer, bladder cancer, kidney cancer. So that multidisciplinary clinic space is going to be available to physicians like urologists, cardio-oncology, our different surgeons to be able to come in 1 to 2 days a month and sort of group their cancer patients together on those days to see them in the Timken Family Cancer Center in conjunction and collaboration with other physicians like Dr. Olyejar and our medical oncology team. And so we're excited to get that kicked off here as well.
Okay. Our final break is here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. Thanks for joining us. Let's get back to the last segment of the show.
All right. Well, Tina, why don't we revisit why the building is so important to patients and the cancer center teams that are there for the patient?
Yeah, sure. Cancer, again, is complex. It requires so many visits and the input of so many different physicians and care teams. And so this building, as I mentioned, is truly comprehensive for the patients. It has all of the physician components. It has the chemotherapy, the radiation therapy, and the ease of access. Cancer patients, they should be given as much time as possible. And so creating efficiencies in terms of wayfinding and drop off and pick up and being able to move from one location to the next is really saving a lot of steps and wasted time for them, during their treatments. And so that really was a focus for us, having all those services in one location. It's also a huge benefit to the providers that are seeing the patients, in this facility, being able to collaborate, having offices next to one another, just being able to walk down the hall and, if they want to work on a treatment plan together on a patient, in close proximity is really beneficial and increases the quality of care that we provide to patients. And so this facility is really unlike anything else that patients have access to locally. Aultman is the leader in cancer care. We see the largest number of cancer patients locally. And so really having a place like this just increases that quality of care, that access to care, and all of the pieces necessary to be able to provide the best possible treatments for patients.
So I'm thinking about your building and its design and how you must have had a challenge getting feedback on how to make that design. We've built many pharmacies and we always go in with the best intentions, and then you get in there and you think, boy, I wish we could have done this or that. So how do you take on a task in a 45,000 square foot space to make it the most efficient you can?
We took a lot of time, Brad, which is the first key. We worked on it for several years and making sure we were getting it right. First and foremost, we worked with some great partners from an architecture perspective. Trinity Design in Columbus is the architect that guided us through this project, and they've constructed numerous cancer centers across the country and really have, a passion for healthcare spaces. Hammond Construction was the local construction company, that built it. But from an input perspective, we had all of our care teams involved in this process, physicians, nurses, medical assistants, donors, leaders. When we were going through and we sort of had the shell of the flow and the layout, we actually constructed the rooms in cardboard mock-ups here on campus. Actually in a church that used to be part of our campus here, we took some of the rooms and the architects came in, and then we took our care teams through those rooms. Can you do what you need to do in this space? If we have an emergency, is it big enough to do X, Y, and Z? So we ran a lot of mock drills in those cardboard spaces to be able to be sure, that we could get wheelchairs in and out of the door, that the exam table was going to sit in the right spot. And all that was extremely beneficial. But the most important part of this was the input from our patients. So we have a patient advisory council here for the cancer program, which is a group of patients and their care providers, their care teams, their support, their loved ones who are part of this patient advisory council. We've been working with them for about the past 5 to 6 years on this project. Unfortunately, some of the patients that have been part of it have passed during that time. But we got feedback from the patients about the flow, the design, the layout, the colors, the lighting. We have a lot of really great artwork in this building. There's a huge nature component and lots of natural light in windows because that was something that the patients really wanted. Sometimes this is the darkest times of their lives and they wanted it to feel very uplifting. So they gave us feedback on the art, on all of those pieces. They sat on every piece of furniture we have in here and rated it and voted on it. And so it is really a patient-informed center. And I think that is what makes it special. And when the patients came through, on the tours and the advisory council came through on their tour, they were really just moved to tears that we listened to them, and we took their feedback and incorporated it into the building. And I think that's really what makes it the best part of the building.
Wow, interesting. Yeah.
It is. So, I guess I want to make sure, you've shared a great message, both of you today, to the community. I want to make sure that patients who are listening or even loved ones of patients who are listening, how can they get more information about your practice, Dr. Olyejar, and other physicians at the Timken Family Cancer Center?
Yeah, we have a great website. The Aultman Hospital has a great website, and then there's cancer subpages in there. That's a great resource for finding us, what we have to offer.
Yeah, altmandocs.com will get you to all of our physicians, and then you're able to navigate to different providers and subspecialties, as Dr. Olyejar mentioned. Also, the cancer subpages on the Aultman website to be able to see what services we provide and how you access those services is all readily available inside there.
One thing we didn't talk about, and I'm thinking with all your planning, you have a solution. Is there space for support groups to meet in the new cancer center?
Yes, yeah, that was another important part, Brad. So we have a very nice community room here in the center, which actually is one large room, but able to separate into two smaller rooms if needed to be able to host different support groups at the same time. We also have a program here called Moving Forward for cancer patients who are in their survivorship phase, which offers access to treatments like Reiki and massage. And so being able to split that room into two to be able to provide those services is also beneficial there. That room also hosts our multidisciplinary tumor board conferences. And so that's, about 2 to 3 times a week, we have all of the different physician disciplines coming together to talk about newly diagnosed cancer patients and what treatment plans should be put in place for them. And so we're able to host that in person here in that room and also have a lot of audio-visual capabilities for those that need to access it remotely. But those tumor board conferences happen several times a week and are very important in the treatment planning and delivery to patients.
Very good. That's exciting to hear. It sounds like you guys have covered almost every aspect of what you can put in a building of this space to take care of the community. So that's very, very well done.
Yeah, thank you. We definitely tried to do that and accomplish that goal. I think we did and had a lot of input from a lot of different stakeholders. So really been a team effort.
Well, we've got about a minute and a half left. Any parting comments that you'd like to leave for wisdom for the community that you're passionate about, or a message to make sure that people understand what's available?
Yeah, I would like to add that, not only do we have a really amazing space, we have really amazing people there too. The team we have in terms of physicians, nurses, medical assistants, we've really tried to structure it in a way that it feels like a family for the patients, right? They're not a number. It shows up. They're important to us, and I think it shows. And we do a lot of behind-the-scenes work like she talked about. We meet together every week multiple times to talk about every new patient.
Interesting. Oh, okay. I think we're out of time. We'd like to have a lot more, but we're out of time.
Great.
Thank you to our special guests, Dr. Olyejar, Aultman Radiation Oncology, and Tina Biasella, Vice President, Cancer Services. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsors, Aultman Health System, Studio Arts and Glass, January Appraisals and Liquidations. As always, you thank our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you again next Friday right here on News Talk 1480 WHBC.